Ever pondered what an oblique fracture is and how it happens? Well, let's start this journey of discovery together. An oblique fracture is a unique type of bone break where the fracture line has a distinct curved or sloped pattern. The word oblique itself means slanting or inclined, and in the context of fractures, it refers to the slanting direction of the break across the bone. This kind of fracture typically arises due to a combination of forces acting on the bone, specifically twisting and bending forces. Imagine holding a stick and trying to snap it by twisting one end and bending the other. That's pretty much what happens in an oblique fracture. What makes these fractures particularly interesting is how they reflect the complex nature of forces that our bodies can endure, and how sometimes those forces can lead to injury. Stay tuned as we delve deeper into the world of oblique fractures. So, how does an oblique fracture occur? Let's start with the basics. Oblique fractures usually occur due to a combination of forces including, but not limited to, twisting and bending. To give you a clearer picture, imagine a stick. Now, if you apply a twisting force to one end of the stick while holding the other end steady, the stick will eventually break. This is a simplified analogy for how oblique fractures can occur in our bones. Now let's get a bit more specific. Oblique fractures are common in long bones, such as the femur, which is the bone in your thigh, and the tibia, the larger bone in your lower leg. These bones are particularly susceptible because of their length and the amount of force they often endure. Think about it. Every time you run, jump, or even just walk, you're applying a certain amount of force to these bones. Combine that with an unexpected twist or bend, and you've got the perfect recipe for an oblique fracture. But don't be mistaken, oblique fractures are not exclusive to long bones. In fact, they can occur in any bone if it is subjected to the same forces. This means that even your smaller bones, like those in your hand or foot, can sustain an oblique fracture if they're subjected to a strong enough twisting or bending force. It's important to note that oblique fractures are different from transverse fractures, which occur straight across the bone, or spiral fractures, which spiral around the bone. Oblique fractures have a slanted or diagonal break, which can make them a bit more complex to treat. The angle of the break can vary depending on the specifics of the injury, but the key point to remember is that oblique fractures are characterized by a diagonal break across the bone. Now that we know how these fractures occur, let's move on to the symptoms. What are the telltale signs of an oblique fracture, you might ask? Well, let's delve into that. Oblique fractures, like any other fractures, come with a set of symptoms that signal something is wrong. These symptoms range from subtle to quite obvious, and it's crucial to be able to recognize them, as early detection can lead to more effective treatment and faster recovery. Firstly, pain is the most common and immediate symptom. This isn't just a mild discomfort. We're talking about intense pain that escalates when you attempt to move or apply pressure to the affected area. Next, swelling in the area of the fracture is a common occurrence. This is your body's way of protecting the affected area and initiating the healing process. The swelling can range from mild to severe, depending on the extent of the fracture. Accompanying the swelling, you might notice bruising around the area. It's the result of blood from the damaged blood vessels pooling beneath your skin. The bruising might not appear immediately after the injury, but don't be surprised if it shows up a day or two later. Another typical sign is the inability to move the affected limb. You may find it difficult to carry out normal movements, or they might be impossible altogether. This is your body telling you that something is seriously wrong, and you should heed this warning. In more severe cases, there may be a visible deformity of the limb or bone. This is usually a clear indication of a severe fracture, and immediate medical attention is required. The limb may look out of place or bent at an unnatural angle, and in some cases, the broken bone may even puncture the skin. In conclusion, the symptoms of an oblique fracture include intense pain, swelling, bruising, and inability to move the affected limb, and in severe cases, visible deformity of the limb or bone. It's important to remember these symptoms, as they're your body's way of signaling that something is amiss. Understanding these symptoms can help in identifying an oblique fracture at the earliest. And remember, when in doubt, seek medical attention right away. Your health and well-being are always worth it. What have we learned about oblique fractures? In our journey today, we've unraveled the mystery of oblique fractures. These are fractures where the break has a slanted or diagonal line across the bone. They're not your everyday kind of fractures, but when they do occur, they pose a challenge that requires accurate diagnosis and treatment. Oblique fractures can occur in various ways. They could be due to a fall, a direct blow, or an indirect force that causes a twisting injury. The forces at play here are both compressive and rotational, resulting in a unique fracture pattern. The symptoms are pretty straightforward. You'd expect pain, swelling, and difficulty in moving the affected part. But remember, these symptoms are not unique to oblique fractures. In conclusion, oblique fractures are a complex type of bone injury that necessitate an understanding of the forces involved, their occurrence, and their characteristic symptoms. Remember, an early diagnosis can make all the difference in the treatment of an oblique fracture.